Why do we have so much waste in healthcare? We don't follow clinical guidelines. There's a tremendous variation in intensity of care. You're all familiar with the Dartmouth Atlas of how procedures vary in frequency from community to community. It's estimated that in Colorado, and I grant you we're not the most up-to-date state, but in Colorado, 17% of physicians use electronic medical records. Wow. We underuse a lot of cost-effective tests and treatment, and we're not meeting access needs. Here are some ways that we waste money on futile end-of-life care and unnecessary cabbages in coronary angioplasty. We waste $600 billion a year. Misuse of drugs and treatments, $52 billion a year. Overuse of non-urgent emergency room care, $21.4 billion. Underuse of generic antihypertensives, $3 billion a year. Underuse of controller medications and asthma, $2.5 billion. Overuse of antibiotics, $1.1 billion. What are some of the other ways we could save money? Accountable care organizations, we'll talk more about that. Chronic disease management. Reduce disparities among physicians and resource utilization. And cover everybody. It would save a lot of money. And why don't we just have a free market system in healthcare? Well, it's not a normal market. Here are the criteria that Adam Smith set so long ago. To be a free market, you have to have a uniform product. It has to be universally available. Everybody ought to know about the product and the price. You should have easy entry to and from the market and price sensitivity. That means suppliers compete on price and not on some other measure. We don't have any of those things. How would we get it? Well, we did these 4 things. It'd make a little difference. Why does healthcare have to be universal? In Colorado, we spend $1.8 billion a year taking care of the uninsured. We spend a grand total of $28 billion a year in Colorado on healthcare. And then, of course, if you have healthy people, they can work. And goodness knows, I don't need to tell this audience about how you can save money with the medical home. We don't have, in the United States, equality of opportunity. Everybody knows about disparities in healthcare. This just shows African Americans don't do as well. This is an interesting slide about disparities. It turns out the physicians' highest rated disparities occur because of money and insurance. Surprise, huh? 50 million people in the United States don't have coverage. It's absolutely embarrassing. 9 million of them are children. Half of the people in the United States have gone at least a month in the last 5 years without health insurance. It's about 1 out of every 4 between the age of 18 and 64. What about justice? Why don't people have insurance in the United States? And it's very simple. They can't afford it. The Coalition for the Medically Underserved did this study a few years ago. We looked at how people spend their money. If you have an income of less than 200% federal poverty level, that's about $44,000 for a family of 4. And if you take care of the necessities in life, look how much discretionary spending you have left over. Nada, zero, zip. discretionary spending includes health care or health care insurance. And you think that people don't have insurance for what reason? 2% of 50 million don't have insurance because they choose not to have insurance. Rush Limbaugh would tell you that there are two kinds of people in this 50 million: illegal immigrants and people who choose to be self-insured. Okay, what about justice? It's unjust for those who are insured to subsidize the uninsured. It's unjust for the poor to pay more for the same service than the rich. It's unjust for American business to bear unequal burden in international competition. It's unjust and inefficient for the uninsured to receive late and expensive care in the ER, and it's unjust to neglect other social investments, some of which have a strong effect on health, to pay for the inefficiencies in our healthcare system. Well, what about compassion? I appreciate I'm preaching to the choir tonight, but let's have a little tutorial on healthcare finances, okay? We spend $2.34 trillion in 2008, projected to reach $4 trillion by 2015. Now more than $8,000 for every man, woman, and child in the United States, twice as much as most other industrialized nations. And how do we spend it? 60% actually goes for health care. This is a very real example, I know, because when I was discharged, I asked to see a detailed hospital bill. I was in the hospital 3 days. My total bill was $52,000. My insurance company paid $12,000. My copay was $400. What about the rest? The hospital wrote it off. Now, what would the bill have been if I'd had no insurance? $52,000. So, what's the relationship between hospital charges and cost? Got it. So what's happening to healthcare expenses in the United States? Totally out of control. A family of four now pays more than $15,000 for health insurance, 22% of their income. By 2020, it'll be 46% of their income. It's predicted that by the year 2016, Medicare will be broke. So, let's get on with it. Yes, and there it is. Obamacare is here. So, wow. What's been the response? You listen to talk radio at all? So it's going to cost $950 billion. Now, what do we get for that? 32 million more covered people. Yippee! And health insurance reform and health care reform. So let's look at those things a little bit. Not everybody's going to be covered. That's a mistake. Would have been cheaper if we'd put everybody in the same pot. Having health insurance is mandated, but then it's not mandated until 2014, and then to start with, it's $95 or 1% of your income as a penalty. Obamacare will put 15 million more people on Medicaid